Good evening, colleagues and other fellow professionals. The webinar is about to start in a few minutes. Please stand by.
O God, who by calling us to the vocation of a medical technologist, has placed upon us the obligation of being a constant help in the scientific care of the sick, grant us by Thy divine light a deep insight into the serious responsibilities of our task. By Thy divine wisdom, awaken in us a growing zeal and determination to increase our knowledge of how to search for the underlying causes of sickness and disease, how to recognize the evidence of physical changes, how to make important chemical analyses, and other valuable tests so helpful in caring for the sick. By the divine love, permit us in this way to share with those who directly care for the sick, that thus we may be constantly working through the eternal Physician, Christ our Lord. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, telas ng sinatanan, alam ng puso, sa likid mo'y buhay. Lupang hinirang, huyag ka ng magiting, sa manduduming, ikapasigil, sa nalagang tulong sa simoy at sa langit mong panglaw, ay nilagang tulya, kawin sa pagkayang minamahal. Ang isang ang matawag mo'y tagumpay ka nagtitingin, ang bituin at araw niya kailan ang haliwang titingin. Lumagang araw na walhagin pagsikap, buhay langit sa piling ko. Ang higaya ng pagkay mag-aamit, ang mamatay ng dahil sa'yo.
Before we start this webinar, here are some guidelines for our virtual participants. First, please observe proper webinar and video conferencing etiquette. Also, please change your settings to active speaker view. To do this, go to the view icon of your Zoom console and swipe or select active speaker view. May we also request all participants to turn off their video feed. Do this by turning off the camera icon at the video tab of your Zoom console located at the lower left portion of your screen. You may post your questions through the link flashed in your screen. For those logged into the Zoom platform, you may post your questions through the chat box at the lower portion of your Zoom console. Details on how to get your e-certificates will be flashed at the end of the webinar. This will be open to those logged into the Zoom platform and to those viewing through our live streaming and Facebook as well. We expect your adherence to these guidelines. Thank you very much and enjoy learning online. Let us all welcome our conference moderator tonight, Mr. John Patrick Tadiosa, RMT, MSMLS.
So good evening, ladies and gentlemen. Welcome to the PAMET Southern Luzon 2020 Regional E-Conference. So I am John Patrick B. Tadiosa. I'll be your moderator for today's conference. So to formally welcome us all for this evening's event, may we have the Regional Director of PAMET Southern Luzon to give his welcoming address. Ladies and gentlemen, please welcome Mr. Oliver Shane R. Dumawan.
Good evening, ladies and gentlemen, and welcome to the PAMET Southern Luzon 2020 Regional E-Conference. I extend my felicitations to our keynote speaker, Dr. Padua, who will be introduced later, to the national officers and board directors of the Philippine Association of Medical Technologists, led by our national president, Mr. Ronaldo Puno. Also in attendance is the chair of the Committee on Chapters, Mr. Lito Atienza. Our national treasurer is also in the audience, Ms. Ellen Garcia, as well as our executive secretary, Dr. Frida Hapan, and all the other national officers of our beloved association. I would like to also extend my greetings to the chapter presidents of the PAMET Southern Luzon region. Of course, also in attendance is the regional director for Northern Luzon, Mr. Edison Ramos, and also our friends and chapter presidents from PAMET Northern Luzon. And of course, a warm greeting to all the medical technologists of the PAMET Southern Luzon region, which is composed of the provinces of Albay, Batangas, Camarines Norte, Camarines Sur, Catanduanes, Cavite, Laguna, Marinduque, Masbate, Mindoro, Palawan, Rizal, Quezon, and Sorsogon, all 14 chapters. It is with a note of happiness that I would like to announce that of all the regional conferences, and this is quite a conundrum, that of all the regional conferences that we've organized for the PAMET Southern Luzon region, this is by far the most that is attended. And I am very happy to note also that we have fellow medical technologists from all over the 14 chapters of PAMET Southern Luzon and even beyond. This pandemic had driven us to extremes, but also it has provided us unique opportunities to once again converge for a night of learning, as PAMET gives you this free webinar that is credited with 3 CPD units. So before I end my welcome address, I would like to announce also a very unique challenge that I think will add excitement to this tonight's virtual event. We have a screenshot challenge for all the attendees that are now here in our virtual meeting place, as well as those who are participating with us in Facebook. So we invite you to take the chance to win 500 pesos, capture a random screenshot of the PAMET Southern Luzon Regional Conference as it happens now, post it in your Facebook account with the following hashtags: hashtag PAMET Southern Luzon, hashtag ONEPAMET, hashtag PAMET Cares, and hashtag PAMET Online Learning. Set your post to public, and we will pick the most creative post that we will see. So again, on behalf of the chapters that is comprising the PAMET Southern Luzon region, maligaya pong pagdalo sa aming pagtitipon na ito. Mabuhay ang PAMET.
Thank you very much once again, Mr. Oliver Shane R. Dumawal, for the welcome address. Now we'll proceed with the opening remarks from, of course, the Philippine Association of Medical Technologists National President. Ladies and gentlemen, please welcome Mr. Ronaldo E. Puno.
Thank you very much, Sir Patrick, and good evening to everyone. Of course, I would like to greet some key personalities, particularly our keynote speaker, Dr. Roberto Padua, ESP President, who will be properly introduced later on. The chapter presidents and officers from 14 South Luzon chapters who are in complete attendance tonight, the members of the board, and of course the organizing committee, as well as the other chapters, okay, across the country. And I would like to greet as well my fellow national officers and board directors, as well as members of the advisory council, our regional directors, of course led by the South Luzon Regional Director, Mr. Oliver Dumawal, and of course with us also is the Northern Luzon Regional Director, Mr. Edison Ramos. To our invited speakers, to all PAMET members, colleagues, guests, ladies and gentlemen, a very pleasant evening to all. I take pride in greeting all of you who are joining the 17th South Luzon Regional Conference being delivered virtually for the first time, as brought about by the current pandemic. And I'd like to just mention that South Luzon is actually the home of the regional conference, because it is where regional conference started 17 years ago. And I'd like to mention also that of all the 4 planned regional conferences for this year, only the regional conference for Southern Luzon pushed through today. So let me congratulate PAMET Southern Luzon region for leaving no stones unturned, so to speak, in order to come up with this truly amazing conference. It's not an easy task to bring all elements together to come up with a masterpiece such as this gathering, especially now that we are continuously being globally challenged by SARS-CoV-2 virus. I have seen how Sir Oliver worked hard for this, and of course, together with the host chapter, Camarines Sur, led by President Juven Peña Florida, and his team. They, of course, work hard to live up to everyone's expectations in this experimental e-conference. And indeed, I would like to claim that you exceeded our expectations, as evidenced by the overwhelming attendance and support in today's event. So as we continue to fight COVID-19 pandemic, we at PAMET never stop in finding ways to be a conduit in fighting it through continuing professional development programs. And thus we find it appropriate and timely to share important updates on the impact of these challenges. And now that the world is fighting COVID-19 as one, there is no better time to share new ways and innovations to better address the current situation. And I would like to take this opportunity as well to pay homage to all our healthcare frontliners whose boundless heroism is really beyond measure. The world could never thank you enough. And let this gathering serve as a testimony to the unwavering commitment of our professionals to help the world as it rebuilds itself until all of us find ourselves in a better and brighter tomorrow. And we are looking forward to the end of this crisis very soon, as we are now closely approaching the Christmas season. We are all praying that everyone would continue to be safe and protected. So enjoy the webinar and continue enriching your hearts and minds, and let this event be a prelude to a bigger PAMET event which is coming on November 25 to 27, and that is the 56th Virtual PAMET Convention. And what's exciting about it is the impressive lineup of local and international speakers who are experts in their respective fields. And what makes it even worth waiting for is that it will be given absolutely free to all our active PAMET members with valid membership of 2021 and beyond. So I encourage everyone to update your membership, because only you could actually avail this free virtual annual conference. And that's all you need to join the convention. And I would say that this is PAMET's early Christmas gift and simple appreciation and thanksgiving to all our members for the sacrifices that you have done in this difficult time. So indeed, PAMET truly cares for the carers, for our members, and for our medical technologies. And with that, I wish everyone an enjoyable e-regional conference. Thank you very much, and good evening to everyone.
Thank you very much once again, Sir Ronnie Puno. That is our PAMET National President. And now we will be having our keynote speaker for this webinar. So to formally introduce our keynote speaker, ladies and gentlemen, let us have our PAMET Camarines Sur Chapter President. For the introduction of the keynote speaker, let's all welcome Mr. Joven C. Peña Florida, please.
Okay, good evening, thank you, sir. To start with, to the PAMET national officers, members of the executive board, our PAMET South Luzon regional director, PAMET South Luzon chapter presidents, guest lecturers, my fellow medical technologists, good evening. I was tasked to introduce our keynote speaker for this South Luzon 2020 Regional E-Conference webinar. Our keynote speaker hailed from a town of Bumbon here in the province of Camarines Sur. He took his education at Ago Medical and Educational Center in Legazpi and graduated Bachelor of Science in Medical Technology as cum laude, and pursue his Doctor of Medicine at Fatima College of Medicine in Valenzuela City. He was a recipient of Dr. Felicidad Kuwalim Awardee as the highest grade in clinical medicine. He was the most outstanding junior medical intern at Fatima College of Medicine and a nominee for the most outstanding senior medical intern at Veterans Memorial Medical Center. He was consistently top 5 in class and ranked number 2 out of the 123 graduates of Fatima College of Medicine and a second placer in the Philippine Medical Board. He took his residency training in combined anatomic and clinical pathology at Philippine Heart Center and passed the Philippine Board of Pathology as clinical pathologist. Also, he took his master's degree in hospital administration at St. Bernadette of Lourdes College in Quezon City and graduated cum laude. Currently, he handled 11 clinical laboratories in Metro Manila, 1 laboratory as a chief pathologist, 6 laboratory as head pathologist, 2 laboratories as an associate pathologist, and the other 2 laboratories as the chairman of pathology and laboratory medicine at Medical Center Taguig and Pasig Doctors Medical Center. He is also the chairman for Quality Assurance Committee at Medical Center Taguig and the chairman of the board of directors at Pasig Medical Center Incorporated. He handled 2 laboratories in Laguna as an associate pathologist at Westlake Hospital and Medical Center and at the Santa Rosa Hospital and Medical Center. He is the chairman of the Hospital Blood Transfusion Committee and Total Quality Assurance Program at Santa Rosa Hospital and Medical Center. He also handled 8 laboratories as head pathologist here in Bicol region. 3 of them are private hospital-based laboratory, and the other 5 are freestanding laboratories. He is an active member of the Philippine Medical Association, Philippine Society of Pathologists, Philippine Hospital Infection Control Society, Philippine Blood Coordinating Council, Philippine Council for Quality Assurance in Clinical Laboratories, that he attended their trainings, seminars, and convention. Our keynote speaker is a doctor in profession, a pathologist at practice, and a farmer at heart. He is the current national president of the Philippine Society of the Pathologists, a pathologist in my workplace, my mentor, a very good friend of mine. Sa Roma na Oragon na Bicolano, let us all welcome Dr. Roberto Daes Padua Jr., FPSP, MHA. Thank you. Okay, Dr. Padua.
Hi, good evening, everyone. Can I share the screen?
Yes, Doc, you can share now. Just click yes.
Okay, good evening, everyone. Thank you, Sir Joven, for the very kind introduction. But I just wanted to be known as a farmer back in our province. Today, I was tasked to talk about the changes in the laboratory amid the pandemic, the Philippine scenario. When our country started to reel from the effects of the COVID-19 pandemic, one constant event happened everywhere, and that is chaos. There were no established guidelines on how to deal with this new virus appropriately. Hence, most of us just adapted to the situation as we went along. As we brace ourselves for the worst, we have seen the healthcare system, especially the clinical laboratories, continue weather the storm and come out better and stronger for it. This is only possible through the diligence, hard work, and dedication of our healthcare workers, our laboratorians, as well as the outpouring of support from the greater community around us, in the form of donations, supplies, especially prayers and support. Laboratories are challenged to maintain testing quality and efficiency amid an increased demand for service and the ever-changing dynamics of the pandemic. Our laboratory professionals have certainly answered the call of the nation in adapting and sacrificing to continuously provide quality patient care. Coronavirus disease, or the so-called COVID-19 pandemic, is a defining global health crisis of our time. It is like any other institutes and industries in the country, clinical laboratories were succumbed to a variety of challenges. Laboratories are challenged to maintain testing quality and efficiency amid an increased demand for service and the ever-changing dynamics of the pandemic. As we all know, every day we receive the updates of the Department of Health stating the number of cases, number of deaths, recoveries, and classification of patients as to symptomatic or asymptomatic. As of yesterday, the total number of affected individuals is 365,799, and out of these, 6,915 were reported deaths. And yesterday, we have 1,923 newly reported cases. This is very significant as we don't know when will this stop. When can we control this particular infection of the virus or transmission? So the laboratories faced with the challenges need to come up with protocols and guidelines to face the daily challenge. What are the challenges faced by the laboratories on a daily basis? First of all, when the pandemic started, there were declining test volumes. The financial effects of the COVID crisis were significant, owing to the lockdown across the country and social distancing campaigns. During the initial phase of the outbreak, the testing volumes decreased significantly compared to the pre-COVID months. This led to substantial test census decline, and the revenue generation target suffered enormously. The major reasons for this are the following. Number one, there are less number of patients visiting hospitals and laboratories because of fear of acquiring the infection. There were cessation of outpatient clinics because doctors also are afraid to see patients. There were postponement of all non-emergency surgeries, causing limited flow of patients to the hospitals with which the laboratory is associated. To cope up with the situation, some laboratories offered home services. The hospital initiated telemedicine for outpatients and home service sample collection for required diagnostic workup. Secondly is the concern of preserving jobs by cutting expenditure, salaries, and compensation. As a measure to ease fixed costs and stave off job losses, new projects including expansions and renovations and hiring of additional lab personnel were put on hold. Likewise, there was a no overtime policy and reminder of saving on utilities and other lab supplies. The next one is ensuring adequate inventory and supplies, which during the lockdowns were very challenging. Adequate supply of personal protective equipment as an essential requirement was ensured with the assistance of the purchasing department. Staff was counseled to practice judicious use of PPE and sanitizers. Staff were directed to revisit their inventory requirements owing to the expected delays in shipment due to the airspace closure, limitation of land transportations, and the delays in the Bureau of Customs to maintain demand supply chain. Due to the rapid influx of inpatients with COVID-19 to the hospital, to which the laboratory serves, there was a surge in demand for some tests related to the diagnosis and prognosis of COVID-19 patients. The impact on external quality assurances and accreditation requirements. Due to logistic challenges, ECWAS, proficiency testing surveys, accreditation, and monitoring visits of the DOH were temporarily put on hold. Due to limited availability of testing kits and consumables, compounded by transportation limitations, the scheduled preventive maintenance and calibrations were also affected. Work from home, movement, and remote meetings. This is especially for our staff who are elderly or with comorbid conditions. Limiting the number of staff working inside the laboratory and the possibility of forming teams or groups that can have an alternate working schedule. Some staff felt that they are better in the vicinity of the laboratory than going home because of lockdowns availability of transportation, and the danger of affecting their families. The last one is very challenging again, is the introduction of new tests in the laboratories. In order to meet the demands of government, physicians, and patients affected by the pandemic, and to ensure continuous growth, new tests are introduced. And very particular to this one is the molecular pathology laboratories doing RT-PCR testing. We also have the antibody test, and now the latest is the antigen testing. These are apart from the other tests not routinely requested in the clinical laboratory, like procalcitonin, ferritin, D-dimer, interleukin-6, and others, which have some bearing on the prognosis of our patients affected with COVID-19. In the process of adapting to the pandemic, our processes have been redefined. Management of patient influx at the main laboratory is a primary concern. As the laboratory caters to both outpatients and inpatients, a noteworthy threat was the local spread of infection from unscreened patients and attendants visiting the facility for diagnostic workup. At present, a special counter was set up with the appropriate safety protocol outside the main laboratory premises for screening using a standard questionnaire asking for travel, symptoms, and others. Suspected COVID-19 cases were refrained from entering the laboratory premises and were diverted to the hospital's specially designated area for screening and management of such cases with appropriate protocol. As COVID-19 is transmitted by droplets and close contacts, patients, staff, and visitors to the laboratory had to wear mandatory masks and face shields, and were provided with hand sanitizers at the counter, and movement in common corridors were restricted. As we all know, at the beginning of the pandemic, because of the lying of some of the patients, it caused death to some of our frontliners. How about the internal surveillance measures being observed or done by the laboratories? All healthcare professionals serving in the laboratory were strictly made to wear surgical masks and gloves. These are the usual health protocols. Staff who developed symptoms were asked to report immediately and were given medical consultation within the hospital staff clinic. This enabled symptomatic staff to be identified promptly, and furthermore, some hospitals offer hospitalization discounts to staff and their dependents in case if they tested positive and requires hospitalization. This was reassuring and taken positively by all the staff, and additionally, refresher training on the use of PPE, especially donning and doffing, was also conducted. We are wondering why healthcare workers are affected by COVID-19 in spite of the PPE that we've been using. Please take note on how they use the PPE, and if ever they can be contaminated during removal of these PPEs. Updates to the existing policies of the laboratories. Following good laboratory practices, all samples received at the laboratory were regarded as infectious, whether or not coming from suspected or confirmed cases, and the hazardous risk was minimized by reducing aerosolization, spill prevention, and reducing unnecessary sample handling and movement. As we all know, the instruction always there is consider everyone a suspect for COVID-19. And we don't need to be complacent on our health protocols. For aerosol generating laboratory procedures, we advise them to be done under a BSc level 2, wearing the proper PPE, with an N95 mask. A fume hood for processing fecal samples is also recommended. As we all know, shedding of the virus occurs in the blood, in the respiratory discharges, in the stool. No? A very challenging area for us during the pandemic is the continuing medical education, which are usually done via virtual platforms because the IATF prevents us face-to-face contacts. Our CME now in virtual platforms foster a learning environment and continue the learning activities of the staff, and the laboratory transition to virtual learning environments using different platforms. Housekeeping activities are also rescheduled in cleaning the laboratories and other parts of the hospital. The house cleaning schedules were redefined and high exposure areas were cleaned and wiped down several times a day with 5% hypochlorite and alcohol-based sanitizers as appropriate. The premises were mopped 3 times a day with disinfectant. Discarded PPE and other clinical waste were collected in biohazard bags and disposed in a proper manner. The very important aspect of the processes that we are redefining is to ensure mental well-being. Most of the staff were demoralized by the pay that other institutions are offering, especially the government. As we all know, during the lockdown, as the government requires more employees, they got some of our staff from the laboratories with offering them higher salary. And the second one now are the molecular laboratories, which usually offers double the salary of a regular medical technologist. However, the staff are encouraged by the leadership of the hospital and laboratories that the positive aspect is their jobs are maintained with provision of additional hazard pay and incentives, and that of discounted hospitalization for them and their dependents. Free meals were sometimes distributed to the staff to create recognition. The management was reinforced to ensure easily accessible channels for staff feedback and concerns. This COVID-19 pandemic is generating significant stress and anxiety in our laboratory personnel, particularly in those with existing mental health problems, in those with elderly or infants at home, and in those with chronic diseases. It was essential for all laboratory personnel, seniors, and junior staff to remain connected throughout this crisis. One of the main reasons for stress came from a feeling of uncertainty. As fear and uncertainty continued, the only key was to spread positivity by staying connected. An important stress releaser activity at workplace is social networking with peers, but with strict observance of the health protocols. These are only some of the measures that some of the laboratories are adopting or are being implemented. During the pandemic, there was one institution we have initialized getting a consensus on our different personnel in the hospital. And this is UPPGH. They have tested their staff, and out of the almost 1,000 staff, only 2% were tested positive for COVID-19. And this positivity of the staff is not much of the healthcare workers, but the support group. Those from the offices, those from the other areas of the hospital. Knowledge factor is very important during the start of the pandemic. There are some misconceptions of their own staff. Akala ko ay normal lang ang may lagnat at maninginig. So hindi yan tama. Hindi naman ako siguro nakakahawa kaya pumasok ako. Hindi rin tama. And this is being done also by other staff. Positive sila, they apply to their hospitals not informing that they are positive for COVID-19. Uminom na ako ng biogesic kaya hindi ako nakakahawa. Hindi tama. Akala ko ay trangkaso lang ito. Hindi tama. Kailangan ko pong pumasok dahil wala nang ibang pwedeng gumawa ng ginagawa ko, kaya nandito ako kahit ako ay may sakit. Hindi tama. Hindi ko po alam na sintomas pala ng COVID ang lagnat at ubo. Very important in this time of pandemic is education. For us to know kung ano ba yung kalaban natin, paano ba siya lumalaban, and for us, ano ba yung ating simptomas na tayo ay tinatamaan ng pandemyang ito. Not all healthcare workers would have the same level of COVID-related knowledge. The hospital ecosystem is diverse and varied, and this is reflective of our society. To succeed, all levels of hospital healthcare workers must be reached by a continuing information campaign. They should tirelessly correct misinformation. A simple symptom can be a manifestation of the infection. So this should be not taken lightly. Some of what they have used to reach their staff are personal phone interviews and counseling, videos shown on PGA's TVs, infographics printed in tarpaulins, Viber, FB, Twitter, Telegram, YouTube, website, personal emails, and COVID Dialogo by FB Live. This is a massive information campaign for the staff to be well informed of the effects of SARS-CoV-2. Okay. We also pick up the best practices that they have instituted in their hospital, which was the beginning of, it begins in some of the hospitals and other institutions make it as adapt whatever best practices UVPGH recommended. The Crisis Command Center in the heart of COVID operations, Unified Call Center for patient queries and donations, cohort setup of COVID-confirmed patients, zoning of entire hospital into green, orange, and red, controlled ventilation system, testing of N95 and KN95 masks, unified donning and doffing areas with safety officers, on-site access to RT-PCR testing with 24-hour turnaround time, and consultation within the clinic of the university. So these are the only best practices observed by UPPGH. They have also given the risk-based levels of personal protective equipment. They have made that special arrangement to ensure that all PPEs for all staff from levels 1 to 4. At the beginning, we all know that there were shortages of PPEs and some improvised. Mandatory use of levels 1, 2, and eventually 2.5, even in non-COVID areas. Fit testing of N95 and KN95 masks, unified donning and doffing areas with safety officers. They have also done timely production and dissemination of information, education, and communication materials. At the beginning of the pandemic, we all know that there were lockdowns, so housing and transport arranged for frontliners and other staff. They have provided air purifying equipment, UV light, and automated hand hygiene dispensers installed in the entire hospital. So with this, the UVPGH have decreased the incidence of infection to their healthcare workers. As we all know, they are one of the referral centers for COVID-19. In July 30, 2020, in September, they have the DOH come up with the Workplace Handbook. This is especially so because of the different guidelines issued by the DOH, the DOLE, and the other occupational medicine people to guide people in the workplace on what to do. I know this has been disseminated, but we're just going to have a glimpse of what is the Workplace Handbook issued by the DOH. There are COVID-19 basics that we must know, all of us must know. How it is transmitted, how the symptoms manifest in the incubation period, and who are the most at-risk population that can be infected severely by the virus. In the different COVID-19 cases, no? They have classified them either as suspect, probable, confirmed, or close contact. This is very important, especially when you do contact tracing. They have also classified the symptoms of your patient either as mild, moderate, severe, or critical, and which one will require hospitalization. This is the hierarchy of prevention, no? That being observed by occupational medicine. And these are the most effective to least effective measures, no, for that particular concern. No? And PPE is the least effective. No? The most effective is elimination by physically removing the hazard, substitution by replace the hazard, the engineering controls isolate people from the hazard, and administration is to change the way people work, and PPE is to protect each worker. So PPE, the use of PPE is the least effective of all the control measures. No? So what are the things that must be done, no, for our healthcare workers and other workforce? No? Always, again, the reminder is to observe the proper health protocols, the wearing of face masks, face shield, hand washing, social distancing, disinfection of all the things that you have used. No? And very particular are the practices of some of the healthcare workers, no? That when they go to the hospitals and when they go home, they take a bath before going in contact with their families. So these are the must do. Next is the management of contact tracing. No? It all begins when the patient, the suspect is manifest with signs and symptoms, you do contact tracing. Huwag nating hintayin po yung mag-positive yung ating RT-PCR before we do the contact tracing. But the testing of this patient should be about 5 days, no? After exposure or when symptoms have developed, whichever comes first. No? If we understand the natural history of infection is that in the first 1 to 3 days after the exposure, it's usually the incubation period. And after the 3 days, a patient can manifest with signs and symptoms depending on the viral load and the immune status of the patient. So, as we all know also, in all the areas of the country, no, the early detection by very strict. No? When we enter establishment, we usually take temperatures and ask for your name and address, contact numbers. So we have the so-called health declaration checklist. No? Whether you have signs and symptoms, whether you have been in contact with suspected individuals, or traveled abroad. Isolation and referral. So for isolation and referral, it depends on the patient has been infected and what can be done. No? It may be isolation or quarantine or hospitalization, whichever, depending on the manifestation or symptoms of your patient. So isolation and referral, it depends, no, whether patients can be symptomatic or asymptomatic. Please always remember that the golden number is 14, no, for quarantine. But in the latest issuances of PCP and PSMID, no, patient becomes non-infectious 11 days after the onset of the symptoms. Okay. These are the clinical status of the patient when to quarantine or isolate. And when are we going to discharge the patient? It's always the 14-day, either symptomatic or asymptomatic. Both 14 days in quarantine requirement, natin or isolation. Okay. Contact tracing is very important, no, for us to control the spread of the infection. But for contact tracing to be effective, all our people must be honest, no? And usually tell the truth to the contact tracers. So you see this all over the country, the different precautionary measures. Okay. Testing, no? The right test for the right reason. No? Okay. As we all know, COVID-19 testing is not 100% perfect. No? It's not 100% positive. Like RT-PCR, the highest positivity is only up to 80%. So it depends also when did you took the specimen and the quality of specimen you have taken, no, for testing. So according to Dr. Edsel Salvana, there's no test that can say with 100% certainty that you do not have COVID-19. With increasing reports of reinfection, assume that everyone is infectious and no one is safe or immune. It's always my advice, no, to our laboratory staff. No? Don't trust anyone in the laboratory, even your friends, your boyfriend or girlfriend. No? They can be infected. How? When they come out of the laboratory, you don't know what they're doing. When they travel, they can go somewhere else, no? Like restaurants, markets. No? They can get infected. No? So those are the possibilities why most of the healthcare workers are not infected in the hospitals, but outside of the hospital. So as you all know, as you see the positivity of the different COVID-19 testing. Okay. Occupational safety and health committees, no? Under the workforce, you're under the magkaroon kayo ng sa committee on occupational health that will monitor and recommends actions for those who have been infected. Okay, so these are just guidelines for patient discharge. So, time-based recoveries recommended by PSMID and PCP. You know, that when you have been with symptoms, when you have completed the quarantine period for 14 days, 3 days, no, symptom-free, you can be discharged. No? There's no need to repeat your RT-PCR anymore. Notification and reporting. No? We are required to report any exposure to COVID-19 as part of the Republic Act, requiring all infectious diseases to be reported to the Department of Health. Okay. Legal balances and entitlements. This is important to our healthcare workers. We have rights of the sick leave, vacation leave, etc., no? And compensation benefits surrounding these particular concerns. Okay. Reintegration after you've been treated, or you have after finishing the quarantine or isolation, you go back to your work. No? But mind you, there are some mental or psychological issues in this particular concern. No? Your coworkers might be afraid that you are still infectious. No? So medyo ilag pa rin sila sa inyo. Okay. So maintaining health for the healthcare workers. No? And this is the usual health protocols that are being recommended by the Department of Health. Okay. Mental and emotional well-being, family support is very important in this time of crisis. No? Diet nutrition, healthy foods, no? Avoid drinking. No? Alcohol is also a recommendation. Okay. Be physically active and fit, no? By doing exercises, which can be done at home. You can also have the BIDA solution, like bawal walang mask, isanitize ang mga kamay, dumistansya ng ilang metro, alamin ang totoong impormasyon. And lastly, you should have a smoke-free workplace, no? Because WHO have said that smoking can aggravate the severity of respiratory infections. Okay. So those were the DOH guidelines, which can be used by the different laboratories as a basis in creating their own SOPs, no, or protocol. I came up with this particular article, no? which is a Singapore laboratory study with regards to their lab considerations during COVID-19 outbreaks. We have the issues and the suggested solutions. For the operational preparedness, the issues is of transmissibility of SARS-CoV-2 via respiratory droplets, and we have several suggested solutions. Number one is team segregation, social distancing, staggered meal timings, and deferment of large group meetings. As we all know, in the workplace, the most common transmission of the infection is during eating. Why? Because you remove the mask, you eat, you talk, and you laugh. So yung aerosols, labas siya ng labas. This is been observed. For example, in one of the doctor that initially lumabas ng lockdown for 2 months. Then after the lockdown, pumunta siya sa hospital to attend to one case na inoperahan nila. Then after which, nagkailan sila. 8 all of them. And all of them were infected. Lahat. Hindi nila alam kung sino yung nagdala ng infection, but one of them is infected. But when they eat, they remove all their protective equipments. At malas na ng isang doktora, siya lang yung namatay out of the 8. So it's always an advice to my staff to prevent eating at the same time. Kasi nagkakwentuhan, nagtatawanan. At ang liitin pa ng mga pantry natin, di ba? Next is reinforcement of business continuity and contingency plans with other departments. We need to be in constant contact with the other departments with regards to their needs. Quarantine measures for staff who are unwell. This is a big question in the laboratory setting. For other hospitals, they have protocols like COVID-19 task force, which usually recommends what are the steps to be done if a staff is becoming symptomatic or exposed. But for small laboratories or freestanding laboratories, they rely more on symptoms. But the problem is the testing. Kaya nga advantageous yung mga laboratories or hospitals with RT-PCR because they can test immediately their staff. Okay, just recently, in one of my hospitals, I have one staff positive for RT-PCR. Since we have the antigen testing, I required all the staff to be tested for the antigen, rapid antigen testing. And again, 3 of them turned out to be positive. So with the high specificity of antigen testing, you can be sure that it's COVID-19. The use of web-based remote learning platforms for training or conferencing. What are the issues in the pre-analytical phase? Potential occupational hazards handling COVID-19 patient samples. That is when we receive the specimens. So full PPE are used while processing such samples. Is an observation in some of the hospitals that when you let them wear the PPE all the time within the laboratory, sometimes others are hard-headed. They remove their mask. So it's just after some time they realize the importance of wearing the mask all the time inside the laboratory. When some other staff are infected, natakot na sila. Leakage of samples in containers or during transit. Samples preferably processed in a Class 2 BSC. Transport of suspected or confirmed COVID-19 patient samples to be within a leak-proof container. Non-pneumatic tubes to be used because they can be broken or cause splashes along the way. And prioritize urgent samples. The lesson there for the specimen is that consider all specimens as infectious. So you treat them as that so that you can prevent any infection. Analytical phase. Manual processes may result in contamination of surfaces, that is centrifugation of samples with aerosol generation and manual pipetting resulting in fomites. Suggestions: conduct a full risk assessment of all analytical processes in the lab. Full decontamination must be performed using approved antiseptic solutions. Second issue is samples not identified as COVID-19 may arrive in the laboratory incognito. So very important that all samples should be considered as infectious as possible. Post-analytical concerns, transmission and reporting of results securely and in a timely manner. Positive cases must be reported expediently to clinical team via hospital alert system and emergency medical records to facilitate the timely treatment and contact tracing. Within laboratory department, a secure means of communication is suggested. In Singapore, they are using the Tiger Connect. In our hospitals, we are using the LIS and HIS. Artificial intelligence to be considered in stratifying patients with COVID-19. So with that, we have now the so-called pandemic era, wherein our medtechs enjoying their new outfit initially. But as the time passes, they hate that kasi mainit na masyado. So that's the initial outfit ng ating mga staff when they are in the laboratory. Complete PPE sila. Okay. At the height of the pandemic also, we have seen also our laboratory staff giving advice to other people to stay at home and just let us work. Para maging maayos ang lahat. That is to prevent more transmission, more infections. This is a hospital laboratory setup wherein during the pandemic, this time of pandemic, we have observed social distancing, wearing of masks, face shields, and this is usually being done, na meron na siyang parang layout kasi medyo malitigas ang ulo ating mga patients. In the laboratory, you can see that there are already steps wherein you can approach the reception area. In the labs also, in the phlebotomy area, we improvise of placing plastic containment to prevent further any aerosol coming out of the phlebotomy area. So that's different from the other more big hospitals when they have more sophisticated barriers. Okay. In laboratory response to pandemic natin, we have observed now that we are more careful in addressing and in processing our specimen. We are in complete PPE when we do phlebotomy. We observe social distancing in the laboratories with complete PPE. And we use BSC when we process some specimen that are probable to release aerosols. Okay. Hospitals in this pandemic, this is the usual setup that you see in hospitals. Madaming tent sa labas because of the screening and triaging of patients entering the hospitals. So this is the lobby of the hospital. As you can see, halos walang tao because we know that there are less people coming into the hospitals because of the fear that they can get infected. It's the same with the laboratory where you have less patients coming in. Okay. At the height of the pandemic also, we have mushrooming of the RT-PCR laboratories. Initially, it is only RITM and the other DOH-based RT-PCR labs. At present, we have already more than 100 PCR laboratories operating. This one is taken from Bulacan, headed by Dr. Espiritu. This one is in Lanao del Norte, headed by Dr. Rana. This one is in Pampanga, headed by Dr. Sanchez. So more and more laboratories are being developed, especially in Mindanao, wherein we have the shortage of manpower shortage of manpower, and the lack of training of the staff. Yun ang naging problema natin during this pandemic. The government is not ready, the healthcare system is not ready, laboratories are not ready to face the pandemic and the needs of the pandemic. So our meetings, usually conferences, are done via Zoom. That is to prevent any face-to-face interaction. It's also the guidelines of the IATF. We have webinars and online meeting trainings also via Zoom or any platforms for education and training of our staff. Okay. Much has been said about the current situations or the scenarios in the Philippines. And we need to prepare now on the post-pandemic era or situation of the laboratories. So these are some of the considerations that we need to put in mind when we go back to our laboratories and think about on what will happen post-pandemic. Can there be another pandemic? There's a possibility. Sana naman hindi in my lifetime. So in time of crisis, follow a proactive approach in anticipating and planning for the impact. Crisis response teams should be part of regular laboratory groups with appropriate training. If need arises, prior standard operating procedures addressing the challenges the lab faced during the pandemic should be in place for immediate referral. The management and the key stakeholders should engage and coordinate formulating policies to tackle such emergency situations. We should pay special attention in identifying the bottlenecks in the respective areas for appropriate alternate plans. One problem that we had during the pandemic and the lockdowns are the deliveries of our reagents and supplies. So I think that can be taken into consideration if ever that happens again for the lockdowns. Decrease workload where possible in anticipation of depletion of resources. Create programs for home services to facilitate the patients in lockdowns and prevent unnecessary movement and reduce probability of exposure in the laboratory. Establish staff segregation, either spatially or temporarily. Work from teams to be encouraged in order to have a few backup personnel if the frontliners are exposed and need to be isolated. This is the idea of forming teams that rotate in the laboratory so that if they're exposed, not all of them are quarantined and the continuity of service in the lab can be done. Staff training on the use of virtual connectivity platforms. As lack of human interaction can be the new norm in the post-pandemic scenario, work culture will need modification on the grounds of social distancing. Meetings and consultations can be conducted online with maximum participation. Social activities at the workplace, including celebration like parties, leisure breaks, are to be calibrated. Rescheduling the meal breaks for the staff and shifts, segregating the staff meal area with provision of limited seating. This is a very important concern. Low salary of the staff, postponed promotions, and for some, the threat of losing their jobs created a negative impact on already disturbed mental status for most employees faced with painstaking objectors potentially risking the lives of their families when undertaking duties in a contagious outbreak. Ito yung consider lagi natin when we are working. We have experienced during the time that some of our staff were not allowed to go in by their parents because of the fear of the virus, to be infected by the virus. Another one is that the low salary that they are receiving is that parang hindi siya commensurate to the risk that you are taking. The lack of social activities further overburden the scenario. Owners and supervisors should play a role and keep the morale high for effective functioning. Furthermore, the budget allocation should be diverted as such to ensure better incentives and remuneration, and maybe fairer to give preference to groups that are more vulnerable. The post-pandemic world, with anticipated overwhelming financial crisis, will require major resource allocation, decisions for inventory management, and prioritizing needs for new development and projects. In 2020, may I borrow the words coming from Sibtain Ahmed et al. In 2020, we woke up in a different world with different set of rules for work environment, financial priorities, and social norms, both at home and workplace. The earlier we adopt and embrace the change, the earlier we will be able to create a safe, workable, financial, social environment for ourselves, our colleagues, and families. So the question there is, when can we see the smiles again of our staff? It is not in the near future because vaccines are not yet available, and there's a continuous transmission of the infection. Remember that if you have only one positive person in a community, undetected, it can continue to spread the infection. In the report by the DOH, around 13% are asymptomatic, and they are the so-called spreaders of the infection. So that can be a problem. So we will wait for the time that I can see my staff without a mask smiling, like this one in the picture. Okay. So when can we again enjoy the company of our friends and colleagues? Wherein we can do social functions. Again, it will wait a longer time again. And hopefully that will come in the near future. So with that, thank you very much and keep safe always.
So thank you very much once again, Dr. Roberto D. Padua Jr., the President of the Philippine Society of Pathologists, for that very comprehensive keynote lecture on the changes in the laboratory amidst a pandemic, the Philippine scenario. And with that, we would like to present a certificate of appreciation, actually an e-certificate of appreciation to our keynote lecturer. So I'll just like to read the text. Philippine Association of Medical Technologists. This certificate of appreciation is awarded to Dr. Roberto D. Padua Jr. for his shared invaluable time and expertise as a keynote speaker during the PAMET Southern Luzon 2020 Regional E-Conference held online on October 24, 2020. Signed, Mr. Oliver Shane R. Dumawal, Regional Director, PAMET Southern Luzon, and of course, PAMET National President, Mr. Ronaldo E. Puno. Once again, ladies and gentlemen, thank you very much to Dr. Roberto D. Padua Jr.
Okay, thank you very much.
Thank you, Doc.
And now, ladies and gentlemen, we will be proceeding with our first plenary lecture for today's conference. So for our first plenary lecture, our first speaker is a graduate of Bachelor of Science in Zoology in the Institute of Arts and Sciences in Far Eastern University. Also finished his Doctor of Medicine in Far Eastern University Nicanor Reyes Medical Foundation. Also finished his Master in Hospital Administration in the College of Public Health, University of the Philippines, Manila. He finished his postgraduate training in the National Institute of Health Advanced Biosafety Officers Training Course at the U.S. Department of State and UP Manila. He received various awards, and to name a few, he is a recipient of the 2016 Biosafety Hero awarded by the International Federation of Biosafety Association based in Ottawa, Ontario, Canada. Professional certification in biorisk management granted by the International Federation of Biosafety Association in Kuala Lumpur, Malaysia in April 2017. Six Sigma Yellow Belt certification granted by the St. Luke's Medical Center on October 19, 2017, Bonifacio Global City, Taguig, Manila. Professional certification in biosecurity granted by the International Federation of Biosafety Association in Kuala Lumpur, Malaysia in November 2017. He is a member of the Department of Health, Health Facility Development Bureau Committee on Laboratory Services, Safety, Research, and Ethics in January 2018, the founding president of Biorisk Association of the Philippines in 2015, biosafety officer at St. Luke's Medical Center, Philippines. Ladies and gentlemen, to talk about transitioning the laboratory biorisk management framework through ISO 35001, please help me welcome our first plenary lecturer, Dr. Miguel Martin Noble Moreno II.
Good evening, everyone. Can you see my screen?
Yes, Doc.
Thank you. A pleasant good evening, PAMET Southern Luzon. I hope you're all safe and comfortable in the confines of your home with your family. First, I would like to thank PAMET National, headed by your president, Mr. Ronnie Puno, for having biosafety, bio-risk management, and biosecurity in the agenda most of the time. Secondly, to Professor Oliver Dumawal for inviting me to this regional conference. To host chapter, Sir Juven Peña Florida, I would like also to say thank you to Dr. Roberto Padua for his very comprehensive lecture. Also to the national officers of PAMET, the chapter presidents, and of course to you PAMET members for embracing the science of biosafety, biosecurity, and biorisk management. That is why you all are the last of the frontliners to be affected by the virus, because you were aware, you are prepared. It is my pleasure to address you again on your annual regional conference. I remember the last time was in Daet, and this is now our new setup being virtual. I hope the message my lecture sends you will be concrete and remembered when you switch off your gadgets after the virtual conference. I take pride in presenting to you a more detailed lecture of my initial introduction to the ISO 35001 version 2019, which I gave at the North Luzon Regional Conference sometime summer last year. My very first encounter with the standard was in February 2019, when the VRAP Vice President and myself, plus the three members, two of which are veterinarians, we attended the U.S. Department of Agriculture International Biosafety and Biocontainment Symposium in Baltimore, Maryland, where they introduced the newest standard of the ISO. It was a 4-day symposium mainly focused on biosecurity of valuable biologic materials, especially the zoonotics. There was a lecture there on introduction to the new ISO standard for biorisk management for laboratories and other related organizations. Of course, following the vision and mission of BRAP, I wanted to bring this home to the Philippines and have BRAP and PAMET again in the front line of biorisk management. I immediately looked for that session in Baltimore and I attended it, listening attentively. The initial discussions were on biorisk management, and you all know about that because biorisk management is the backbone of this new standard. So let's review a little about biorisk management. As we all know, biorisk covers both biosafety and biosecurity, where the identified hazards are the biological agents and their products. In biorisk management, we establish and implement systems and policies in order to manage these laboratory biorisk. And biorisk management should be integral in the day-to-day operations of the laboratory, both in normal time and in times of emergencies, such as the pandemic. So what were we following before the ISO? This is the history of the CEN issuances. CEN is European Committee for Standardization. It is CEN because the original name is in French. And an output of the CEN is called a working agreement. So we call it a CWA, meaning CEN Working Agreement. It is by definition not an official standard from the member organizations. Take note that CWA does not have the status of a European standard, and it involves no obligation at the national level. To give you a detailed overview, let me briefly discuss CWA issuances concerned with the biomedical laboratory and biorisk management. So let's go to the first, which is CWA 15793. You all remember this, CWA 15793. We have all used this from 2008, and this is what we were following. It's the most famous CWA we have encountered all through these years. Remember that, CWA 15793. It is a laboratory biorisk management standard, which was written in 2007 and then adopted in 2008. The development of CWA 15793 involved 76 participants from 24 European countries. They convened and wrote and finalized the draft, and its distribution was funded by the European Commission. It lasted for 3 years, yun yung kanyang lifespan, after being released in 2008 and was superseded by the 2011 version, whose distribution was made available by Health Canada. We used this until 2019 when the ISO finally made its grand entrance as being the new standard for biorisk management. Leaving the 15793, we go into the 16393 of 2012. What's important in this document? It presents guidelines for the implementation of the CWA 15793 version 2008 and eventually 2011. So if your organization accepted the CWA as its biorisk management standard to follow, you need this document to help to be as your guide to help you in its implementation. Other documents is the CWA 16335 of 2011. This one describes competence in the areas of a biosafety professional. International, national or regional regulations or directives take precedence over the CWA. The 16335 provides informative annexes and model role profile and model tasks of a biosafety professional in an organization. This helps to define competence requirements. It also provides a model training specifications for reaching competence. The BIRAP has adopted this, and we started it on pilot basis in Mindanao, and it's doing good. But I will tell you another news later on. That 16335 intends to provide a framework for those who work in the biosafety and biosecurity fields. So those who are interested in pursuing a career in biosafety, this one is used to evaluate your competence as a professional and to identify areas for development in yourself and in your organization. In the context of this document, biosecurity is restricted to laboratory biosecurity also. Kasi merong field biosecurity. This one is for the laboratory only. There is a move now. This is the good news. There is a move now to convert the CEN workshop 16335, this one, by ISO again and make it into a biosafety professional competency standard. So masipag silang gumawa ngayon ng mga standards nila. This is how it looks. I'm sorry, I didn't realize it will be this small. So the document covers a scope, informative references, of course, abbreviations always, role of the BSP in an organization, and biosafety professional background qualifications and competencies. Tapos all the annexes will describe the coverage of the document. So we are using now the CWA 15793, the 2011 version, because the 2008 version expired after 3 years. Because it has a limited lifespan of up to 6 years. We use this standard just to keep our laboratory safe and secure until the public showed that there was still a need for a new laboratory biorisk management. So if you count 2011 plus 6 years, the total lifespan of the CWA, it expires in 2017. Several major biosafety organizations and countries from all regions have confirmed the need to convert the CWA 15793 into a suitable guidance document. So as early as 2014, the ISO took on the task to standardize biorisk management. And on 2017, in its last year of existence, they started drafting the new standard. So the new standard is what we call now your ISO 35001 series of 2019. ISO started working to develop the new standard by 2014, and then they drafted it in 2017. And they wanted it to be consistent with other ISO management standards such as ISO 14001 and 54001, which are all risk managements for different specialties. Out of the 163 member countries, each one had to vote and decide for issues. Even if there was just one vote that didn't approve the ISO, they would deliberate on that. So this is a very well-discussed document, and it is now the standard for biorisk management in laboratories and other organizations. These are the pictures of the committee, the technical working group who was tasked with the creation of the ISO 35001 2019. This came out November 2019. So what is the ISO 35001 2019? It's a newly created standard. It was released, and its official name is Biorisk Management for Laboratories and Other Related Organizations. So it's not confined just to the laboratory per se, but also to organizations who, like BIRAP and PAMET, push for the biorisk management of laboratories. So what is this standard all about? We have four specific reasons why the ISO was created. It responds to a need in the market. As we said earlier, ISO does not decide when to develop a standard. They simply respond to the industry's call or need for a standard. So the laboratory talks to the ISO in the country, the ISO leader in the country, and then the ISO stakeholder in the country communicates with the ISO in general headquarters in Europe. Second, ISO standards are based on global expert opinion. So it's not just written by a few people in Europe. If you remember, I said there were 160 participants from 64 countries all over the world. So that's the coverage. The experts creating the standard negotiate, and all aspects, which include scope, key definitions, and content are discussed. The third is the standards are developed through a multi-stakeholder process, which means the technical committees are made up of experts from the concerned industry, which is by safety, by security, and by risk management. And they form consumer associations. And from consumer associations, the academe, NGOs, and government. And the fourth is these standards are deliberated upon and checked on a consensus-based approach, taking into consideration all of the stakeholders' comments. As I said, just one stakeholder who does not conform to the standard, they will deliberate on that until it is finally decided upon. So what is the ISO 35001? It's actually a biorisk management system itself. What's beautiful is now we have a real standard that all we need to do is just follow it. So always remember that whenever we say biorisk, we always refer to both biosafety and biosecurity. The biorisk management system presented here is based on a management system approach, which enables an organization to effectively identify, assess, control, and evaluate the biosafety and biosecurity risks inherent in its activities inside the laboratory. As such, this document is intended to define requirements for a biorisk management system that is appropriate to the nature and scale of any organization. The biorisk management system is built on the concept of continual improvement through a cycle of planning, implementing, reviewing, and improving the process and actions that an organization undertakes to meet its goals. You have heard this, I'm sure. This is known as the Pdca principle, the plan, do, check, and act principle. If we look at the ISO 35001 quality management system approach, imagine you are looking at a pyramid and you are on top, a drone view. This is the top to down pyramid view of a biorisk management system model lifted from the first few pages of ISO 35001. You will need to exercise a little constructive imagination here and see this figure from the top, like viewing, as I said, the top of a pyramid. You know, when I was creating this this lecture, I was really very careful because the ISO 35001 is a copyrighted material. And when you talk about copyright in Europe, it is very strict. They send you only one copy through electronic, and that electronic file is tagged. Whenever you put it on the internet, it tells the ISO office where it is. If that file becomes 2, they also know where it is and who started spreading or having the file copied. They are very strict, honestly, I tell you. Therefore, going back to the pyramid, the topmost circle is labeled support, which is your admin involvement in the system. Around it, followed by the leadership of the organization taking charge. It's the leader who takes charge of the Pdca process. Next layers going down is 4.3 and 4.4 labeled scope of the biorisk management system. So you have there telling us who is in charge, and then what is the scope, what is the coverage. And then followed by its foundation labeled 4.2, understanding the needs and expectations of the interested parties, together with 4.1, understanding the organization and its context. I hope you are still with me in this pyramid thing. Now, this top of the pyramid view of a biorisk management system. Ayaw gumalaw. Okay, we superimpose the pyramid on this same figure. This is the top-down pyramid view of the biorisk management system model lifted from the first few pages of the ISO 35001, as I said earlier. You need, I hope your imagination is as vivid as mine. You see the arrow, leadership surrounded by the Pdca, and then you have the internal, external issues, intended outcomes of the management system, and the needs and expectation of the interested party, which comprises all the context of your organization. So when you start implementing the ISO 35001 in your organization, you will have to do this initially. So what is the Pdca cycle? I'm sure many of you know this already. It's based upon a quality management system framework. It is specific for biorisk management programs that integrate best practices and procedures built around the Pdca cycle. It all boils down to continual improvement. These are all for the continual improvement of your laboratory and the entire organization the laboratory belongs to. So the appropriate figure to use to describe the Pdca should be this one. We see the 4 steps of the process, and at a certain point, it is repeated regularly to achieve the continuous improvement as it is defined. More often than not, the cycle may be repeated twice or thrice, depending if the issue was addressed. So there is one cycle after the other describing the problem. So you plan, you do, you check, and you act. At a certain point, you see it is not yet addressed. So you continuous improvement, and then you plan, you do, and you check, and you do, you check, and then you act. So here you will see to repeat the Pdca cycle until you are satisfied with your results. This process is called the multi-loop Pdca. So when you have a problem, plan, do, check, and act. It's not solved, you go to another Pdca. So you do that many times until it is solved. And then you do a risk assessment again every now and then. So what are the key points of the ISO? It is not a technical document. Well, anyway, the 15790 was not also a technical document. It is not intended to replace any national or subnational regulatory requirements that may compliance with regulatory requirement is mandatory. What does it mean? You want to apply ISO 35001, and I'm sure you will do one of these days. Whenever you start looking at the document, the new standard, you always put the DOH issuances on top of the ISO. So if the ISO tells you this is it, and what DOH tells you there is another way of how we do it in the Philippines, that will be the standard to be followed, the one issued by the Department of Health. So all other international standards and laws are always superseded by the Department of Health issuances. Always remember that. Where can you use ISO? When you want to improve your overall biorisk performance. It was mentioned by the keynote speaker that now in the new era, you have to do a biorisk management always prior to doing anything in your laboratory. When you need a framework or structure for effective biosafety, biosecurity program manage, you use the ISO 35001. When you want to communicate the awareness defined in your organization, you follow the communication process as defined in the ISO 35001. When you need to improve international collaboration, you also use this one, especially the ISO, because in the international arena, this is already the gold standard. Excuse me. So let's peek into the contents of the ISO. This is the part of the lecture which I really had to ask permission. I had to make sure I was not falling into the trap of wanting to disseminate it. So the ISO 35001 has 10 sections and it's only 26 pages. Yung CWI 15793, 49 pages yun. So the 10 sections are here: the scope, the normative references, terms and definitions. Of course, palaging kasama yan. Context of the organization, which I briefly discussed earlier, the pyramid. And then it talks about leadership, planning, support, operation, performance evaluation, and then improvement. So let's go into the sections one by one. Mabilis lang ho ito. Scope number one. Number one is scope. ISO defines an approach to identify, assess, control, and monitor the risks associated with biological materials. It is applicable to any laboratory or other organization that works with stores, transports, and disposes of biological materials. ISO 35001 is not intended for laboratories, remember, which test for presence of microorganisms or toxins in food or feedstuff. It is not intended for management of this form use of genetically modified crops in agriculture. Why? Because there is an ISO specific for these ones. So this one is particularly for the laboratory handling biological materials. So number two, normative references. How lucky are we that there are no normative references for this standard? What are normative references? They close lists for information of the documents which are cited in the text in such a way that some of or all of their content constitutes requirement for the document. So let's go to the third, terms and definitions. For the whole 26 pages, there are only 46 defined terms for biorisk management. And if you go to some of them, you will find out that we've been doing this already from the 15793. So they show their requirements. They talk about the biorisk management system itself, biological agents, and versus biological materials, hazards versus risk versus biohazards, biosafety versus biosecurity versus physical security, reliability and competence, conformity versus non-conformity, incidents versus accident, corrective and preventive actions, and validation versus verification. How I'd like to discuss this, but it is not in my power. So next is context of the organization. Think back at the pyramid earlier. There are 4 sections under the context of organizations. Understanding the mission and the vision, determine interested parties and the requirements, determine boundaries of virus management system, external and internal issues regarding section 1, which is the scope, and establish, document, and implement communication, maintain and continually improve a biorisk management system, which is the most critical. Always the biorisk management system. Number 5 is leadership. So what does it say about leadership? It has 3 sections. First section is leadership and commitment. You need to ensure policy are established and compatible with the organization, available resources, communicate importance of system, achieve its goal and outcome, being all well and documented and verified. Yun ang trabaho ng leadership. Second is policy. Top management shall establish biorisk management systems. They should be made available and communicated to all. It should protect worker and visitor, environment contamination, assessing and prioritizing risks, reducing biosecurity risks, and the last is roles and responsibilities. Guidance for roles and responsibilities, always following the chain of command. So it is always from number 1 to number 5, never from number 5 to number 1, and never in between. So you have top management, who is supported by senior management. After the senior management, you have your biorisk management committee. Committee muna before you go to your biorisk management advisor or your biosafety officer or your biosafety professional. And then you go down now to your diagnostic and scientific management. Number 6 in the standard is planning. There are 2 sections under planning. One is action, address risk and opportunity. So you identify the threat, you do an analysis, and then you do a risk assessment, and then you mitigate on the assessment, and then you check if your mitigation is doing good by doing a performance evaluation. So if not, you go back to number 1 again, simply the PDCA cycle. Always remember biorisk management objectives and planning to achieve them, in order to achieve them. The 7th section is your support. It has 8 sections. Well, first is resources. When you talk about resources, you should have a worker health program. You should have issues on vaccination of your workers. Second section is competence. Make sure that the behavioral factors and worker management are always following the competence. At this point in time, we are still using the CWA standard for competence because ISO has not yet come up with the new standard, ISO standard for competence. And personnel reliability measures. Then third is training and retraining. Retraining for biosafety should always be after biennially, every 2 years. And then the 4th is communication. Then you have document information. When you talk about documented information, you have general information, creating and updating your information, control of documents information, and of course, information security. This is more of biosecurity already. And then non-employees. How do you deal with non-employees in your laboratory? Then personnel security. And then control of suppliers. Very important. I have seen laboratories, big laboratories of tertiary hospitals where all of a sudden you see somebody inside the lab who is wearing street clothes and asking around, and When I asked around who was that man, he was a supplier. So you need to control that in the ISO standard. Then we talk about operations. This is one of the longest sections. It has 8 sections. Operational, planning, and control. You have to have their policy, which tells you how you are doing it and how are you controlling the risk. Commissioning and decommissioning. It's not enough that you hand over a new laboratory to your customer. It should be properly commissioned. And when you have a laboratory that is already old, dilapidated, and you want to close it down, you have to do a proper decommissioning of that laboratory. Number 3, you have maintenance, control, calibration, certification, and validation of your equipment. The worst thing you can do is buy a machine and have the seller do the certification. You should always have at least a second party or a third party for certification and validation. And then you talk about physical security in operations. You talk about biological materials and inventory. You talk about good microbiological practices, basic GMT you all learn in school. Then you talk about clothing and personnel protective equipment, PPEs, and your uniforms. What is the issue now in this? ISO deals with it that you should not bring out of the laboratory whatever you're wearing inside. Worse is you don't bring it home for washing. So we talk about decontamination and waste management. And then preparedness, response, and contingency planning. You have emergency scenarios, emergency plan training, emergency exercises and simulators. These are what you call your drills. And then you have contingency plans. What is plan A, plan B, plan C, depending on the emergency. And the last one is your transport of biological materials, which is always included in every standard that talks about the laboratory. 9, performance evaluation. Okay, you did a Pdca, you have mitigated, you should now do performance and evaluation. What does it mean? After monitoring, measuring, you analyze and you evaluate. Is it working? Is it good? Or do you have to do another Pdca? You have your internal audit. Better yet, you have an external audit or third party helping you out on this. And then your results are submitted to management review, of course, with your recommendation for proper addressing by the management because they have control of your resources. And the last section is improvement. Because we talk about Pdca, you always have to go into continuous improvement. These sections include the general, incident, nonconformity, and corrective action. And then how will you continually improve this on a regular basis? So those are the 10 chapters of the ISO 35001 and their corresponding sections. I'm sorry, but that's what I can only present to you. So how will you learn about this? You attend more and more trainings on ISO. Not one training will give you the entire ISO in itself. So if you attend many, especially the risk assessment part using the ISO, you will be able to complete the standard in itself. You're supposed to buy the standard, and it's 118 Swiss francs. I think it's almost $100 or 5,000 pesos just for the 26 pages. I lifted this from the ISO website, the official name of the standard. It's abstract, and the price of is for a single use, non-copy, non-print electronic copy of the standard. Napakahigpit nila talaga. So I think that ends my lecture. I'd like to thank again Sir Oliver of course, the regional director and the PAMET national president, Sir Ronnie Puno. My helpers when creating this slide so that I won't be what they call sued for copyright claim. Ms. Maureen Ellis of the International Federation of Biosafety Association. Dr. Cecilia Williams of Sandia National Laboratories. Mr. Sean Kaufman, who was my guide in creating, in giving me an outline, my very first outline, which I developed into. And of course, the Pakistan Biological Safety Association for their guide also in presenting this this standard, because they already have presented this. And if they were not sued, I will not be sued also. So with that, good luck. I hope we go into the ISO. And with that, I'd like to thank you all for your attention. And if you have any questions, I don't know if they will be addressed here, but you can always email me with a BRAP email. Thank you very much.
Thank you very much once again, Dr. Miguel Martin and Moreno, the President of the Biorisk Association of the Philippines 2015, on the topic, Transitioning the Laboratory Biorisk Management Framework through ISO 35001. Okay, and you may now post, to all our participants, you may now post your questions either through this chat box or the link presented in the slides. So let's start the question and answer portion. So for Dr. Martin, we have some few questions here. So our first question is, are there ISO 35001 accredited labs already in the Philippines, Doctor?
I don't have that figure, but I know there are 3 already going for it, and they are the big medical centers, tertiary hospitals. I don't have the exact figure.
Okay, Doctor. Okay, thank you, Doctor. Another question we have here is, what would be the greatest challenge for laboratories in the Philippines if they want to be an ISO 35001 accredited laboratory?
The greatest challenge is to admit that you have biohazards, to address these biohazards resourcefully, meaning get the proper resources. Hindi na tayo pwede dun sa pwede na. Tatlo lang naman yan eh. It's pwede na, and the better one is pulido, and the last one is palpak. Tatlo lang naman yan sa atin. So the greatest challenge is to move from pwede na to pulido through using the CWA 15793 and the ISO 35001 together. I think that's the best way to do it, since there is no guidance book or handbook for implementing the ISO. It's good to shift from the CWA 15793 to the ISO 35001 slowly.
Okay, thank you, Doctor. Another question is a basic ISO for quality management, such as the ISO 9001, needed before a laboratory can apply for ISO 35001? Again, I repeat, is a basic ISO for quality management, such as the ISO 9001, needed before a laboratory can apply for the ISO 35001 you just discussed?
This question was asked in the US, and I will quote unquote the answer I heard. If your laboratory is ISO 900 certified, well and good. But remember, that is for quality management. We are talking about the risk, biorisk management for the ISO 35001. It's totally different. And again, with the help of your 9001, it is a good stepping stone already into the implementation of your ISO 35001. If you notice, I always repeat the numbers. I am trying to brainwash the audience.
Thank you very much, Doctor. And there's just one last question. It might be a little bit off topic, Doctor. One participant asked if can a non-practicing medical technologist can still join the BRAP?
Oh, of course. It's remember, PAMET is our official partner, but we have members also as veterinarians, pharmacists, chemists, nursing people, anybody who is interested in risk management, because that is the main objective and goal of BRAP, is to learn how to do a risk management. And I particularly chose PAMET to be the partner of BRAP, is because if you look back, who are the people in the laboratory, the majority of the people in the laboratory? Who do you think dominates the lab in terms of profession? The pathologists, the medtechs? Excuse me, Dr. Padua. It is the medtechs. And you want to address the problem, you go to the grassroots level. You go to the medtechs who comprise 85%, 87% of the laboratorians in our country. The others are the pathologists, the molecular biologists, the cytogeneticists. Those are the others, but 87% of the laboratorians are medical technologists.
Okay, thank you very much, Dr. Martin. And
you're welcome.
For other questions from our participants, again, just like Dr. Martin mentioned, you may directly email him through the BRAP email, or you can send your questions through PAMET so that it can be forwarded to our speaker for today. And with that, we'd also like to present an e-certificate to our first plenary lecturer. So once again, this certificate of appreciation is awarded to Dr. Miguel Martin N. Moreno II for his shared invaluable time and expertise as plenary speaker during the PAMET Southern Luzon 2020 Regional E-Conference held online on October 24, 2020. Signed, Mr. Oliver Shane Ardumawal, Regional Director for PAMET Southern Luzon, and of course, PAMET National President, Mr. Ronaldo E. Puno. Once again, ladies and gentlemen, we have Dr. Miguel Martin N. Moreno II. Thank you very much, Doctor.
Thank you very much. Magandang certificate niyo. Thank you. Thank you.
So with that, ladies and gentlemen, we will be proceeding to our second and the last plenary lecture for today's conference. So our second lecturer is a graduate of Bachelor of Science in Psychology in Far Eastern University. Also, she is a degree holder of Master of Arts in Psychology from Pamantasan ng Lungsod ng Maynila, and a PhD holder in clinical psychology from the University of Santo Tomas, Philippines. Currently, she is a professor at the College of Education, Arts and Sciences at Lyceum of the Philippines, University Batangas. The university psychologist of the same university, Lyceum of the Philippines, University Batangas, a clinical psychologist by profession. Ladies and gentlemen, to talk about developing resilient healthcare professionals, mental health and coping amidst COVID-19. Please help me welcome Dr. Lida C. Landicho.
Hello, everyone. Good evening, ladies and gentlemen. It is really my honor to be with the people who are, we consider our heroes. We know that we are all experiencing this kind of mental health, no? And this is very timely since we are celebrating the Mental Awareness Month this October. So thank you so much, Sir Oliver and the rest of the PAMET officers for inviting me to talk about mental health. So I'm going to share my presentation. Okay, so developing resilient healthcare professionals. The World Health Organization have mentioned that we will be experiencing the next pandemic, and that is the mental health. This COVID-19 actually brings a huge change, and it brings the world upside down. So there are a lot of changes that brings a lot of chaos and confusion among a lot of people, not only in the Philippines, but the entire world. Okay, so at this point, itong discussion natin is not just as so technical and medyo mabigat kagaya ng mga previous talk. So at this point, I'd like to ask our participants to share about how do you feel at this point, no? What do you feel? Kumusta ba ang ating puso ngayon? Okay? So you will be using the chat box in the Zoom. Okay, merong chat box diyan. And I want you to rate your heart. Kumusta ang ating puso ngayon? Okay, so you're going to rate it if it is 0. 0 meaning you are broken, you are damaged, or your heart is malfunctioning. 2, if you feel you are depressed, if you are disheartened, or you feel miserable. Or let us, if your heart is 4, ikaw ay malungkot, no? You are unhappy, you are worried. Or is your heart is 6? Is it 6? You are masiyahin, you're good, you're happy, you're joyful. Okay. Or 8, matatag pa rin, no? You're strong, you are resilient. Or is it your heart 10? Yumayabong, or is it flourishing? Okay? So share your thoughts, share your heart, share your responses by indicating your answers in the chat box. Ayan. So we have 8, 10, 4, 6. Okay. Thank you so much for your responses. May 0 pa talaga. So tamang-tama talaga yung sinasabi, ano? Ngayon, siguro, alam niyo that a lot of news coming out about suicide and depression, anxiety, not only experienced by adolescents, but even the middle age and old age actually are experiencing this kind of mental issues. Okay. So when we talk about mental health, we were always talking about physical health, no? Kasi lagi tayong physical health, di ba? But when mental law was introduced and enacted in the Philippines, biglang nabuhay yung mga tao when we talk about mental health. People are hesitant to go to a psychologist or to a psychiatrist. Kasi alam nyo naman ang Pilipinas, di ba? Ang mga Pilipino, if they know somebody is consulting a psychiatrist or a psychologist, they have already in mind that this is suffering from this kind of abnormalities. And they had this stigma that it runs in the family, okay? So, well, fortunately at this point, people are become open about mental issues. Okay. Now, mental health and physical health go hand in hand. The mind, okay, let me just, okay. So the mind and body are not separate. What affects one affects the other. So healthy body and healthy mind means a happy life. So we will have a flourishing life if we will have the physical health and the mental health. Now, we have been talking about mental health, but I know all of you are in the medical profession and you are familiar with these terms such as anxiety and depression. But, just a review, okay. Ang anxiety kasi, kasama na to when we talk about mental health. This is actually one of the common problems encountered today, anxiety. Anxiety actually, it's a stress. It's our Anxiety is our normal response to a threat. So normal lang, di ba? Lahat naman tayo nagkakaroon ng anxiety, especially kapag meron tayong gagawin, di ba? But sometimes, nakakatulong tong anxiety kasi it keeps you stimulated, mas na-challenge ka sa pag may mga anxiety na ganyan. However, it becomes a disorder if it already impairs the normal functioning. So therefore, if a person is suffering from what we call physiological or physical manifestations or behavioral manifestations such as like insomnia, kinakabahan siya, nagpapanik siya, 'di ba? Meron tayong tinatawag na general anxiety disorder. Basta na lang siya nagwo-worry, basta na lang siya kinakabahan pero hindi niya maintindihan, 'di ba? Hindi yan makatulog, unable to concentrate, okay? And itong pandemic na to, maraming tao talaga, a lot of people experience this kind of anxiety disorder. So therefore, parang nawawala na sila, no? Nawawala na sila ng enthusiasm, nawawala na ng motivation. And I said, if it impairs the normal functioning, then it becomes a disorder. And if it is a disorder, so therefore, there is a need for medication. So just like depression, depression is not just simple sadness. Depression is a clinical disorder. It's a clinical depression. So, and it can lead to suicide. So I said it is not just a simple sadness because there is no amount of physical or material that can equate this feeling of depression. So just to say, no, there are manifestations, physical and behavioral manifestations of depression. And I said there is really a need for medication along with psychotherapy. And you know, there is no direct relationship whether mahirap yan or mayaman yan, because this is really biological. So therefore, kaya alam niyo, even those people who belonging to the affluent family or famous, and yet they still, in spite of whatever they have committed suicide, okay? Especially now that we are suffering from pandemic, they have already this kind of disorder, and it was enhanced because of this pandemic. So, you know, when we talk about mental health, parang COVID yan eh. You know, COVID na asymptomatic, that we do not know who are the carriers of the virus. So mental health is just like COVID, no, it is invisible because there are a lot of people who can look confident and yet they have anxiety. There are people who are so beautiful, they have six-pack, and yet they are self-conscious, you know, and people can smile, people can laugh, and yet they are depressed. And people can be successful, they have everything, they are rich, but still they feel unworthy. So this means that we do not know the struggles of our people. We do not know the struggles and the predicament of the people around. So we need to be kind always, because everyone is fighting a battle you know nothing about. When we talk about coping, there are a lot of coping strategies to become resilient. Resiliency meaning we are thriving in order to survive in spite and despite of the adversities that we are experiencing. Alam nyo, ang mga Pilipino is, syempre sikat naman yan when we talk, I mean, we are very famous when we come to resiliency. Lagi tayong nakakakita ng bagay na mabuti na lang, di ba? Buti na lang. Yung bang laging there is always hope. Okay, so that is actually one way in which we can really display our resiliency. It is manifested in our own culture. But I'd like to share to you, how do we become resilient through positive psychology? So I'm going to share to you some of the concepts that will help us to become more resilient. First is positive emotions. You know, positive emotions are the hallmark of happiness. When we feel positive, when we have positive emotions, we tend to become more creative. We are optimistic. We can do everything that we want if we have the positive emotions. Kapag ang emosyon mo ay positibo, di ba, mas magaan, ang dami mong naiisip, you become more, yan nga, ang dami mong naisip na magiging kang creative, di ba? Kasi ang positive emotions, if you will see people, if you see around, like your friends or your co-workers, makikita mo ang mga tao na may mga positive emotions, di ba? Sila, kapag maganda ang positive, kapag maganda ang disposition nila, they have the positive perspective in life, pleasant yung mukha nila, di ba? Mas bata, mas okay, mas light. Pero kapag there are people who are so pessimistic, they're always negative, they're always look at the negative side, and then mas nakikita mo na mas parang negative din ang kanilang aura. Okay, so this is also something to do with our emotion. So the question is, how can we have positive emotion? Paano nga ba magkaroon ng positive emotions, di ba? Well, one is laughter. Tayo mga Pilipino, when we laugh, alam niyo yung laughter na yung talagang nauutas ka na. I don't know those who know about utas. Yung talagang feel mo na ikaw ay tawang-tawa. Ang sarap sa pakiramdam ng tumatawa. And when you are laughing, it gives you that kind of feeling, a kind of relaxation. Okay. Now in psychology, we have what we call laughter yoga. So, walang stimulus. You need not to be stimulated to laugh. Kasi tayo, tumatawa because there's something na pinagtatawanan tayo. There is a stimulus. But in laughter yoga, walang stimulus. Pero, tumatawa ka nang walang tinatawanan. Kaya lang, I recommend if you do this, do it alone in your room because people will be, thinking about something else when you do it. Okay. So laughter yoga is when you really laugh, there are some physiological reactions in your body that will bring positive feeling. Okay. Another is when you hug, diba? When you hug someone, it releases this oxytocin, and it also release or remove the stress from our body. And then sa mga bata, yan, so meron tayong mga batang participants, di ba? When you see someone that you admire, parang nakakaiba ng feeling, nakakagaan, parang wow, nakita ko na naman si crush, di ba? So that can bring positive emotion. And then spend time with a loved one, okay? Spending time with your loved ones, with your friends, can also bring positive emotion. Well, love letters or text, holding hands. So holding hands mo. Ngayon, so syempre wala mo ng holding hands. Pero, by just holding hands also calms the nerves. And the positive attitude lowers the risk of heart attack. Okay? The second concept of positive psychology, which will help us to become more resilient, is mindset. Mindset is everything. Everything starts with the mindset. It is our attitude. It is the response, actually. What makes it different? What makes it different is the attitude that we have. Like, we all have this pandemic, marami ang maaaring nawalan ng trabaho. Siyempre, marami ang nakakulong, naka-quarantine. But we are all suffering, no? We are all experiencing this pandemic. And what makes it different is the way we think about the pandemic. So it's just like the ABC concept. The A stands for activating event. The A is the activating event. And then the B is the belief. It is the belief. And then the C is the consequence. So therefore, A, B, C, no? So ang A will, ang B, it is the belief. It is how we look at the A. And C will depend on the B. So therefore, if we will be thinking about like, kailan kaya matatapos tong pandemic na to? Ilang beses hindi na ako nakakalayas, hindi na ako nakaka-travel, nakakainip, nakaka-bore, ilang days. You are counting the days where you are stuck in the house, di ba? Or you are in very uncomfortable situation. But if people will think about the other way, like you are counting the days, not of the days that you were stuck in the house, but you are counting the days where you are being protected by God. So, naiba ang ating reaksyon depende sa ating iniisip. So everything starts with the mind. Everything starts with how we look at things. Everything starts with the way we rewire our brain. I don't know if you are familiar with Carol Dweck. It's about the growth mindset. Alam niyo ngayon, there is also a theory that intelligence is no longer inherited. Intelligence now is acquired. It is acquired. So therefore, it depends on how we live with the things. It depends on how we react with the situation. Like if we have the fixed mindset, ang fixed mindset is just like, okay, eto na, this is it. I am miserable, I am nobody, this is really my destiny, so I can't do anything about it. So that is how people think if you have the fixed mindset. But if you will have what we call the growth mindset, meaning you look every rejection a way of, it is your way of becoming more creative and more smart. And this is your way, being rejected is just a way for more opportunities. Pag na-reject ka, the more you are driven, no? Na kailangan matapos mo to. Mas ang tao ay nagiging palaban, mas nagiging resilient siya, mas nagiging malawak ang kanyang pangunawa, mas nagiging smart siya, di ba? And those who have experienced, okay, those who have experienced difficulties in your life, di ba? Parang, and you were able to survive it. Di ba parang, wow, there is nothing that you cannot survive because you were able to survive it. Di ba? You know, I remember, like, when Taal volcano erupted, because I am from Laurel, so when it erupted, I was there, and I thought that it was really the end. No, we were all anxious that time, and then after the Taal volcano. After 2 weeks, eto na naman, pandemic na naman, na-quarantine na naman. And you know, people who live in the area, instead of thinking like after the volcano and then there's pandemic, they have a different mindset. Ang mindset nila, buti na lang at nagpumutok ang bulkan dahil sa dami na nag-donate, sa dami ng bigas at sardinas at noodles, hindi sila magugutom. See? So it depends on the mindset. So our response and our reaction to things is actually depend on the way we think about it. Okay? So that is why mindset is everything. So therefore, We need to rewire our brain to spot for positivity, good things and things that will make us feel good and happy. So what does it mean? It means that we can be able to really adjust, we can be able to rewire the way we think, and we can be able to choose to be or to feel good and to be happy. Another way in which it can help us to become more resilient and to lessen the burden and to lessen our mental health issues is mindfulness. This is something that I don't think everybody's doing. Kasi lahat tayo, I know everybody is busy from the moment na every morning, we are all thinking about what will we do, nakahanay na yan, the things that we need to do. So this mindfulness thing is, I think, being neglected by a lot of people. So when we talk about mindfulness, it's just being aware and being conscious, being focused of the things. And there are a lot of scientific studies that mention that this mindfulness strategy really help a lot of people in their relaxation and stress relief as well. Okay. Mindfulness meditation has something to do with focus, attention, awareness. So you have to have really time. You set a time for meditation. And then, like, for example, okay, one example is that before waking up in the morning, so you can do the grounding technique. This is one example of meditation. This is one way. This is grounding technique. Ano ba yung grounding technique? Like, for example, you are still in your bed, and then before you wake up, it's your meditation. So like, for example, you can like look around you, look around in your room, and then you identify 5 things that you see. Okay, it's a simple meditation. So 5 things that you see, like you can focus your mind. You can focus your mind on the color of the curtain, like the color of your roof, your books, your linen. Like, identify 5 things and take note that your mind is focused on the 5 things around you. And then after identifying the 5 things, then you can like, what are the 4 things that you can feel? What are the 4 things that you can feel? Or the 3 things that you can hear? No? When you are thinking about, like, for example, you are in the middle of the grounding technique and then suddenly something came up, thinking about, oops, ang dami ko nga palang gagawin. It's okay. Kasi talagang normal lang yan. But the thing is, you just have to go back to that technique, to that concentration of looking at the things, hearing the things, feeling and smelling or tasting what is at present. Okay, and it is just a simple way of meditation that will help us really relieve the stress. Gratitude. Okay. Gratitude is just a state of being thankful. Kaya nga, no, tayong mga Pilipino, laging mataas ang ating gratitude, mataas ang ating resiliency. Nasunugan na, buti naman, at buhay. I mean, there is always something to be thankful, that despite of what is happening around us, there is something to be thankful. Think about your family, think about your job, diba? Kaya alam niyo, when people are dying because of COVID-19, ang sabi ko nga, hanggat ang tao'y humihinga, yan, hanggat ang tao'y humihinga, maraming tao ang, kung maaari ay bumili ng hininga para mabuhay. So therefore, as long as we are breathing life, and we are breathing the blessings. So therefore, there is nothing that we can do. There is nothing that is impossible if we are still alive and breathing. So there are so many things to be thankful despite the adversities. And of course, we have another concept of positive psychology, which is helpful in making us more resilient, is the strength. Okay, so before I talk about the strength, I'd like to ask again our participants. Paunahan tayo ha, participants. Okay, ready? Sana hindi pa kayo inaantok. I want you to write in the chat box. Tingnan natin kung sinong mauna sa inyo. I want you to write in the chat box the alphabet in the correct order. Okay. Can you, who is the first person who can write the alphabet? Yeah, we have Stephen, Chua, Michelle, Lucille, Diana, Evelyn, Alan, Victoria, Lorraine. Thank you so much. So easy. So easy. Lilibeth, Johan, Jenny, thank you so much. There we have it. A lot of people. So easy. So easy. Okay. So at this point, I have another instruction to make. Okay, without looking at the previous text. Okay, nobody will look at the previous text. Conscious, ha? I want you now to write the alphabet reverse, starting from Z. Can you write the alphabet in a reverse method without looking at the previous text? Okay, anyone? Not Z to A, Vendeaño, Par. Yeah, I know it's hard to do. Is there any? Who is the first person? Okay, Jessie. Melchi, Joanne, Jenny. Okay. There we have it. Salamat sa mga nag-participate. Copy-paste. I know it's difficult. I know it's difficult. You know what? This is something to do with this. You know, remember when we were young children, like when we were young kids, and when our parents, of course, I know our first teachers, our parents were teaching us to memorize and identify the A, B, C. It was so difficult then. Diba? Napakahirap naman eh. It was so difficult. It is like you are in a wilderness. You are in a grass. There's no pathway and you don't know what to do yet. No, you don't know what to do. You know where to go kasi wala ka pang dinadaanan. Okay. But when you have started learning about these things, you keep on learning, relearning and relearning, then you have created a pathway until you have the third picture. Yan, meron ka nang nalalakaran because you have been doing it the same all over again until you have the highway where everything is comfortable. It is so easy, mas malawak, mas madali, di ba? Wala ka nang kahirap-hirap kasi ando na siya. It's just the same thing. It's just our strength, di ba? So remember, that's the same. Kung sigurong itinuro sa atin when we were young kids is Z, Y, Z, it will be easy. So lahat ng bagay ay nagsisimula sa mahirap. Dahil wala namang hindi mahirap. Diba? So we all started with this grass. There is no pathway. But once we do it every single day, and you are familiar with these things, then everything will be easy. It's just the same thing, you medical technologists. I know it was so hard then, but because you are doing it and it becomes your life and your profession, so therefore it is easy for you. So this is the same with life, no? Kapag sanay tayo na ganyan natin dalhin ang nangyayari sa ating buhay, mas nagiging, it becomes an automatic behavior. Diba? Mas nagiging madali para sa atin kasi nagagawa natin yan. Okay? Ayan. So that is the positive psychology, the concept of positive psychology. And to give you another way to cope our mental health and to really enhance our well-being, we have here the 8 ways we can do. We have here the talking, being open with people you trust. Alam niyo, when you have these emotions or negative emotions, which is very common and familiar naman, is you have to really call someone, your friend, your very close friend, or someone that you really trust, and then you can share your feelings. Kasi mas nakaka-alleviate, nalilesen ng ating negative emotions when we share it with someone that we trust. Okay? And another is exercising. It was mentioned in the by the first speaker that exercise really is very helpful. You know, I also experience anxiety. Really, this pandemic, even ako a psychologist, but there was some times that I had this panic attack. But because I know what to do, like I do exercise, kapag nagpi-paint, because I am into painting, so I know kapag medyo nangangatal ako, oops, may panic, parang may panic attacks ako. So what I do is, I don't take medicine, but I do exercise. So may mga Zumba. Ang Zumba kasi, or when you dance, mas, nakaka-release siya ng happy hormones and na-alleviate yung feelings ng anxiety. Okay, calming, or this is what I have mentioned, like meditation, learning. I know you are all busy, but learning is a continuous process, and kahit anong edad natin, mas nakakatulong sa well-being natin if we will be learning new things. Learn new things. Like I am 45, I just kung kailan 45, dito ko nag-aral ng painting, ng piano lesson, ng mga kaklase ko yung mga 5 years old, di ba? So ganun, because there's always, ways, and there will always be time to learn new things, okay? And then we have relating. It, of course, one way is when you relate with people, you share with people, spending time with people that you care about can also help our well-being. And then contributing is also a way. Like, this is social interest in psychology. There is a feeling when you contribute not only to the group but the society, di ba? Another is creating. Express yourself creatively. Ang mga medtech, marami diyang mga artists, marami diyan na talagang mga creative. So you can also, aside from being a medtech, you can also do some artistic works, di ba? And of course, congratulating. At the end of the day, lalo pa ko kayo, no? Kayong mga frontliners, kayo talaga na we really respect and we really honor kasi you are risking your life to serve this country, and you are you have to really congratulate yourself with the efforts that you make. Okay, so before I end the talk, let me share to you this, that the secret of a happy life is giving God the first part of your day, the first priority to every decision, and the first place in your heart. Thank you very much.
Thank you very much, Dr. Lida Silandicho, for that very, very interesting lecture on developing resilient healthcare professionals, mental health, and coping amidst COVID-19. Once again, ladies and gentlemen, Dr. Lida Lindicho. So with that, we will be having another question and answer portion. So Dr. Lida, I have here some questions.
Sure.
Okay. For our first question is, what is your point of view regarding those people who tell that we should stop normalizing resiliency amidst a problem? Because whenever there is really a problem existing at hand, again, what is your point of view regarding those people who tell that we should stop normalizing resiliency amidst a problem when there is actually a problem existing at hand?
We cannot get away if we will not be resilient. Then it will be more problematic and it will be more dangerous. Being resilient is being we can be able to thrive with the adversities. Kasi if someone will stop normalizing and stop being resilient, then there is no way. There is no way. I mean, to really promote well-being. Then that will be the start of a more disastrous and danger in mental health.
Okay, thank you, Dr. Lida. And how do we distinguish loneliness from actual depression?
Well, there is a big difference. There is a big difference between loneliness and depression. As what I have told you, depression is a clinical disorder. It is a clinical depression that needs to be medicated. Loneliness is actually triggered by something that is negative, something that is not appropriate for the person, such as rejection or failure, or those are the things that made some people lonely. And depression is a clinical that there is nothing, no stimulus to trigger the behavior or the emotion. It just come up, it just experienced by people who are really depressed.
Okay, doctor. How can we prevent getting depressed by our depressors, such as workload, colleagues, pressure in the work, all this?
Okay, you mentioned about colleague. There are many factors. There are many ways in which stress can be triggered by these external factors. So, when it comes to work, when it comes to colleagues or co-workers, we cannot do about it. We cannot control other people. We cannot control the volume of work that we have, but we can control and we can manage ourselves. And that is why I have told you that mindset is everything. I just remember, I just wanted to tell a story about a friend who is very she has this kind of boss who is very hostile, very domineering, very bossy, very, a very negative boss. And she's always nervous every time she sees the boss. And what she did is, at home, she got this Winnie the Pooh thing, the Winnie the Pooh, the small toy. And then inatong niya sa table. Tapos sinabi niya, alam mo nyo yon, kasi yung boss niya is maliit, na mataba, parang, and then she looks like that Winnie the Pooh. So, ang ginawa niya dun sa Winnie the Pooh, sinabi niya, pinagalitan niya, sinabi niya yung pangalan, tapos sinabi niya, alam mo ba, yan yung ganyan. So, you know what, parang displacement, we call it displacement. And then, when she's with the boss, o kaya kapag pinapagalitan siya ng boss niya, kawawa talaga si Winnie the Pooh. Alam nyo, pero it's just a way, no? It's just a displacement. So every time she looks at the boss, every time she's with the boss, she doesn't feel any negative emotion anymore. Because what she feels, what she looks, I mean, she looks at it as a Winnie the Pooh. Meaning, ganon na niya na-alleviate yung kanyang pakiramdam sa isang tao. So therefore, look at this. Because we cannot do anything about these people. We cannot make magic. These are beyond our control. So anything beyond our control, you can't do anything. But there is something that we can do, our mindset.
Okay, doctor. We just have two remaining questions here.
Sure.
You just mentioned about mindset. There is a phrase that we call "it's all in the mind." Is it correct? And up to what extent can the power of mindset affect psychosomatic issues that we may feel?
Okay. Well, when we talk about psychosomatic, it is a different kind of disorder. So this is a distinct disorder. So psychosomatic is actually physical. Yeah, it is physical manifestation brought about by stress. And somatic can also be a manifestation of anxiety. So therefore, when we talk about it's only in the mind, it's different from mindset, okay? When we talk about psychosomatic, yes, it is in the mind because the stress and the anxiety and the worries can be converted into physical stress. And that is why they feel different kinds of ailment, muscle pain, headache. But when you are going to test in the laboratory, it's negative because these are all psychosomatic. And there is no physical basis actually. That's why, yeah, it's in the mind.
Okay, thank you po for clarifying that. And for the last question po, what is the immediate help that we can give to a depressed person? Or is there a quick exercise to calm down when a spot or situation that could trigger stress?
Okay, well, that's what I have mentioned when I discussed about the depression. Depression is something that cannot be just equated with, cannot be by just mere talking or giving any special gift to remove that kind of loneliness or sadness. It's different. So any kind of major depression, especially if you see people who are manifesting these symptoms of depression for almost 2 weeks, then therefore they need to be medicated. Medication is the first and the initial move that we need to do, and along with psychotherapy, because psychotherapy will not work without medication.
Okay, well, thank you. So I think there might be some other more questions, but in the interest of time, we will be forwarding it to you, Dr. Lida, so that we can send it to our participants for the answers. And so with that ends our question and answer portion for the second plenary lecture. So we will also be presenting an e-certificate to our second lecturer. So once again, this certificate reads, the Certificate of Appreciation is awarded to Dr. Lida Silandicho for her shared invaluable time and expertise as plenary speaker during the PAMET Southern Luzon 2020 Regional E-Conference held online on October 24, 2020. Southern Luzon and the President of PAMET National, Mr. Ronaldo Ipuno. Once again, ladies and gentlemen, Dr. Lida Landicho.
Thank you so much. Thank you, PAMET.
Thank you, Doc Lida.
Okay, so with that, before we proceed to claiming of your e-certificates, we will be first having a closing remarks. So to formally close today's event, may we have the chair on PAMET Committee on Chapters. Ladies and gentlemen, please help me welcome Mr. Lito G. Atienza for the closing remarks, please.
Okay, good evening, colleagues. Okay, to our beloved President Ronaldo Ipuno, to our PAMET National Committee Chair, Regional Director of Northern Luzon, and Advisory Council. To our guest speaker, Dr. Martin Moreno, BIRA President, Dr. Padua, PSP President, and Dr. Landicho, Professor Lyceum of the Philippines University. Oliver Dumawal, Regional Director of Southern Luzon, and the Chairman of the e-learning, Sir Juven Peña Florida, President of CAMSUR, and the organizing committee, the participants, and then Southern Luzon Regional Gentlemen, good evening. Last year, CAMSUR was chosen as to hold the 17th PAMET Regional South Luzon pandemic. It was postponed, and it will be scheduled next year. And then this virtual conference is given by the active chapter member. I would like to thank your time for sharing your precious time and expertise. We learned so much of this convention. All the lectures are excellent, very timely, and relevant. To Sir Juben and Sir Oliver Dumawal, thank you very much for all the e-convention. As well as I would like to congratulate all the organizer for doing this event. Would like also to acknowledge all the chapter president in the region, and also the participants for the participation. Mabuhay ang PAMET and good night. Marami pong salamat.
So thank you very much, Sir Lito Atienza, once again, Chair, PAMET Committee on Chapters. So we will be having our awarding of the Screenshot Challenge winners of 500 peso each. So congratulations to Mark Loy Lacap de Pusoy. We also have Joyce Antonio, Ralph Encanto, and CJ Barros. So congratulations. You just won 500 pesos. You just won 500 pesos. To all the winners, you email your contact details to PAMET Southern Luzon at gmail.com on how you can claim your 500 pesos. So congratulations po sa inyong lahat. And with that, we are ending the PAMET Southern Luzon 2020 Regional E-Conference. The details on how you can claim your e-certificate will be flashed here on the screen. So how to claim your e-certificates. So answer the e-conference post-evaluation using the link to be flashed in the succeeding slide. You must be a PAMET member with updated membership for 2021 or beyond on or before October 24, 2020 to be eligible for the e-certificate. Please double check your email address and full name before submitting your post-evaluation. And please be reminded the e-certificate will be sent to your registered email address within 10 working days. And the link will only be open for the next 30 minutes. So this has been John Patrick Tadiosa, and maraming salamat po sa inyong pagdalo sa ating seminar for this evening. So ingat po tayong lahat.